everyone, my name is Jana Ompartim.
I am Kimberly Pepito.
And I am Marie-Claire Sendico.
We are
We
the
are the
student
student nurses from Notre Dame of the Jangas University. Today, we will talk about
Fractures. What are the common causes and the different types?
clinical manifestations and emergency management.
What is fractures? A fracture is a complete or incomplete disruption in the continuity of bone structure and is defined according to its type and extent. Fractures occur when the bone is subjected to stress greater than it can absorb. So what are the common causes of fractures? Fractures may be caused by direct blows, crushing forces, sudden twisting motions, and extreme muscle contractions. When the bone is broken, adjacent structures are also affected, which may result in soft tissue edema, hemorrhage into the muscles joints, joint dislocations, ruptured tendons, severed nerves, and damaged blood vessels. Body organs may be injured by the force that caused the fractures or by fracture fragments. What are the different types of fracture? Fractures may also be described according to the anatomic placement of fragments. An intra-articular fracture extends into the joint surface of a bone. The first type of fractures is the complete fractures. A complete fracture involves a break across the entire cross-section of the bone and is frequently displaced or removed from its normal position. The second type of fracture is the incomplete fractures. An incomplete fracture, such as the green stick fracture, involves a break through only part of the cross-section of the bone. This more commonly occurs in children. The third type of fractures is the comminuted fractures. A comminuted fracture is one that produces several bone fragments. Another type is the closed fractures. A closed fracture or simple fracture is one that does not cause a break in the skin. The last type is the open fractures. An open fracture, compound or complex fracture is one in which the skin or mucous membrane wound extends to the fractured bone. Open fractures are graded according to the following criteria. For the grade 1, it is a clean wound less than 1 cm long. For the grade 2, it is larger wound without extensive soft tissue damage or avulsions. For the grade 3, it is highly contaminated and has extensive soft tissue damage. It may be accompanied by traumatic amputation and is the most severe.
Laboratory tests. Because each end of a long bone is cartilaginous, if the fracture is non-displaced, X-ray will not always reveal the fracture because cartilage is non-radiopaque. MRI or arthroscopy will identify the fracture and confirm the diagnosis. Clinical manifestations. The clinical signs and symptoms of a fracture include acute pain, loss of function, deformity, shortening of the extremity, crepitus and localized edema, and ecchymosis. However, not all of these are present in every fracture. Pain. Pain is continuous and it increases in severity until the bone fragments are immobilized. The muscle spasms that accompany a fracture begin within 20 minutes after the injury and may result in more intense pain than the patient reports at the time of injury. The muscle spasms can minimize further movement of the fracture fragments or it can result in further bony fragmentation. Loss of function. Loss of function happens after a fracture, wherein the extremity cannot function properly because normal function of the muscles depends on the integrity of the bones to which they are attached. Pain contributes to the loss of function, and in addition, abnormal movements such as false motion may be present. Deformity. Deformity happens when displacement, angulation, or rotation of the fragments in a fracture of an arm or may it be in the leg causes a deformity that is detachable, especially when the limb is compared with the uninjured extremity. Shortening. In fractures of long bones, there is actual shortening of the extremity because of the compression of the fractured bone. Sometimes, muscle spasms can cause the distal and proximal side of the fracture to overlap, which may cause the extremity to shorten. Crepitus. Crepitus is caused by the rubbing of the bone fragments against each other. It happens when the extremity is gently palpated, wherein it can be felt or it can be heard. Localized edema and ecchymosis. This happens after a fracture as a result of trauma and bleeding into the tissues. These signs, however, may not develop for several hours after the injury, or it may develop within an hour. It depends on the severity of the fracture.
Emergency management. In the emergency department, if a fracture is suspected, attention is given to the patient's general condition. Assessment of airway, breathing, and circulation, which includes pulse in extremities, is conducted. After the initial evaluation has been completed, all injuries identified are evaluated and treated. The nurse inspects the entire body, observing for lacerations, swelling, and deformities, including angulation, shortening, rotation, and asymmetry. All peripheral pulses, especially those distal to the fractured extremity, are palpated. Adequate splinting is essential. Immobilization of the long bones of the lower extremities may be accomplished by bandaging the legs together with the unaffected extremity, serving as a splint for the injured one. In an upper extremity injury, the arm may be bandaged to the chest, or an injured forearm may be placed in a sling. Closed fractures. The patient with a closed fracture has no opening in the skin at the fracture site. The fractured bones may be non-displaced or slightly displaced, but the skin is intact. Patient education includes self-care, medication information, monitoring for potential complications, and the need for continuing healthcare supervision. This includes proper methods to control edema and pain, exercise to maintain the health of unaffected muscles, modification of home environment, use of assistive devices. Open fractures. In an open fracture, the objectives of management are to prevent infection of the wound, soft tissue, and bone. IV antibiotics are administered immediately upon the patient's arrival in the hospital, along with tetanus toxoid if needed. Wound irrigation and debridement are initiated in the operating room as soon as possible. The wound is cultured, and bone grafting may be performed in all areas of bone defects. If there is any damage to blood vessels, soft tissue, muscles, nerves, or tendons, appropriate treatment is implemented. The extremity is elevated to minimize edema. Neurovascular status must be assessed frequently. Temperature is monitored at regular intervals, and the patient is monitored for signs of infection. A spill,
A slap,
A hospital trip.
so never give
safety,
A day off.